Hi, everybody. Welcome to the January 10th half day talks. Today I'll be talking about shoulder surgery prehabilitation. Just a quick thanks to Dr. Phillip and Dr. Borman. So, objectives for today are to look into the evidence and indications for pre surgery exercise or physiotherapy for shoulder surgery, such as rotator cuff repair or shoulder instability. And we'll also look at literature uh, for pre-op physio elsewhere in orthopedics, as well as I thought it'd be fun to look into what patients can find on the internet when they look up prehab exercises. So prehab for shoulder surgery, there isn't a lot of great evidence out there looking at pre-op physiotherapy and if it would be beneficial for shoulder surgeries such as rotator cuff repair or stabilities or subacromial decompressions. There's a lot more literature focusing on arthroplasty and ligament reconstruction. There's also a decent amount of literature in the general surgery world regarding this topic as well. But did find this article though that focused on shoulder surgery specifically. So this is from the Journal of Pain Research in 2016, focusing on people undergoing shoulder arthroscopy. So this is a prospective cohort out of Indiana State University. So they looked at 124 patients undergoing shoulder arthroscopy for either bursectomies, acromioplasties, or labral repairs, or quote other shoulder surgeries. So going over their results, so they found pre-op physiotherapy did not significantly influence post-op pain or disability scores. They also found that pre-op physio did not influence how long someone needed to do post-op physio for, or how long their sessions were. There were some significant drawbacks to this study, though. They didn't specify what type of pre-op physio was done. They even say in their paper that we just asked, did you do it or did you not do it? They didn't even ask how long they did it or what type of physio they did. So that's a pretty big drawback in my mind as well. And we also don't know what type of surgeries these other surgeries were, whether they're rotator cuff repairs, arthroplasties, or whatnot. So not the best study, but one of the only ones that I could find that was focusing on shoulders specifically. So elsewhere in ortho, there was a systematic review and meta-analysis looking at arthroplasty, specifically knee and hip, mainly knees. So this was a systematic review with 22 studies, including 1,492 patients. So they found that most of the studies had a high risk of bias. They weren't all randomized, but they did find that there was some decrease in post-op pain at 4 weeks. However, beyond the 4-week mark, pre-op physio didn't seem to have any effect on pain or functional scores. So this is just reiterating the results, so no clinically relevant findings past 4 weeks. Some of the limitations of this study, there's small patient numbers in the studies that they included. They had different physio protocols, or the protocols were not listed at all in the studies. But their main conclusion was that you need to do more research and more patient numbers to get a clearer picture of whether or not pre-op physio for arthroplasty is useful. This study here was looking at ACL reconstruction and preoperative rehab. So this was a cohort study looking at two groups of patients undergoing ACL repair, those that had extended prehab and those that did not have extended prehab. So they looked at the Moon database as well as the Delaware Oslo databases. So they found that in those undergoing ACL repair with significant pre-op rehab, that they had a higher return to support levels than those undergoing no preoperative rehab. So there was some significant differences in the groups that I found reading this study, namely that the people in the group that had extended prehab were already quite active before. They had to be in to be in that group, you had to have at least 50 hours of sport before your injury, whereas the control group was all comers, so ages 18 to 85 with ACL repair, and they didn't really look at people's activity levels for that control group. So this was a study I just wanted to quickly bring up. This is from general surgery, so this is looking at prehab for kind of all types of abdominal surgeries. So they showed that people that went through their specific rehab protocol showed decreased complications, shorter length of stay, and cost savings for the hospital if you participate in a rehab program. So obviously very different from ortho, but just showing that in other areas of medicine that pre-op physiotherapy has been shown to be useful. And just quickly, what can patients find out there? So if you type into Google pre-op rehab exercises, you can a whole bunch of stuff comes up. Lots of these websites bill their exercise programs as prehab, but they don't really mention whether or not this is useful to do before surgery. Most of it is geared toward injury prevention, but some of these websites specifically label it as prehab. So again, we don't have a lot of evidence seeing if this is useful, but there's a lot of stuff out there that people can find, and I think it's worthwhile, especially if people are looking for injury prevention. There's lots of good stuff out there. And just a quick general health tip: it's always good to follow that advice. So, in conclusion, there's not a lot of good evidence for pre-op physiotherapy for shoulder surgery. There is evidence outside of shoulder surgery in other areas of orthopedics, such as arthroplasty and ligament reconstruction, showing that pre-op physio may be beneficial, but the current research isn't that impressive. And like most topics, more research and greater patient numbers are needed to investigate this topic further. And there's my references. Thanks for listening.